Thank you. Neil Findlay, Convener Health and Sport, please. Mr
Thanks,
Findlay.
good afternoon. Almost every witness that comes before my committee, except senior health board managers, civil servants and ministers, and the people who we speak to in private briefings, raise the issue of cuts to health and social care services that is impacting on patients. One of the doctors summed it up well when he said there appears to be a gulf between the strategies promoted by government and what actually happens in reality on the ground. Could you offer any explanation for that gulf existing?
I don't accept that is the case. I'm not sure what witness you're referring to. I absolutely do accept that.
Lots of them.
Well, let me answer your question. I absolutely do accept, and this is something I was very conscious of when I was Health Secretary, that often the relatively easy bit of a government's job is to come up with the strategy, to come up with the document. How that then translates and the relationships and the discussions and the dialogue and the hard work that has to be done to translate that into practice on the front line is the difficult bit, and that's where our frontline health professionals deserve so much of our gratitude. So, you know, there is a lot of work goes into that. Am I sitting here saying we always get that right? And at a time of change for our health service, and transition, which is what we're going through right now, the challenge of that is more significant. What we are doing in terms of health, firstly, we're making sure that health gets record funding. So the health service budget under this government is going up by £3 billion. We will increase it over the life of this Parliament by a further £2 billion, £500 million more than the rate of inflation. There are record numbers of staff working in our health service, but as we all know, the demand for health services, largely because of changing demography, are rising as well. Now that then brings into sharp focus the need to change and reform the way we deliver services. The principal piece of work we've done around this, of course, so far is through the integration of health and social care, and I'm aware from my own constituency experience as well as my first ministerial experience that the work that's been done on the ground to turn integration, the legislative part of integration, into reality with proper strategic plans and the delivery of services in place is a monumental undertaking, but I think that is working well, and those working in the front line are doing a fantastic job around that. So we have to make sure that we've got the right frameworks in place, the right funding in place, the right staffing numbers in place, and then support our health services to make changes. Sometimes this will include controversial changes that get more services delivered in the community, closer to home, so that over time we can relieve some of the pressure on acute services. And as I say, that will involve difficult decisions at some time. And as I said in the Chamber a couple of weeks ago, you know, there'll be moments of truth for all of us in whether we're prepared to face up to some of those difficult decisions.
So the from surgeons to doctors to nurses to cleaners and kitchen staff in our hospitals and in our social care field, we've heard this repeated time and again. Is someone misleading them into believing that there are cuts to services happening?
I didn't accuse anybody of misleading. I understand very well the pressures that frontline health care staff work under. That's always been the case in the health service because of some of the issues driving increased demand. That is even more the case right now. So I'm not for a second denying the very real pressures that health service staff at all levels of the health service work under, nor am I denying the things that they say to your committee. I'm simply trying to outline the task that we all have, and as First Minister, that I have principal responsibility for ensuring that we undertake to make sure that we fund our health service as well as we can within the overall financial constraints we face, and that we support our health service to change in ways that the changing demands on it frankly necessitate. And that is about integration of health and social care, getting more money out of the acute service into social care, which we've started that process with the £250 million transfer this year, which we want to build on in future years. It's about making sure that we're building up primary care, and we've already also signalled our direction of travel in terms of transferring more of the health budget into primary care. It's about making sure that we invest properly in mental health care services, all of these services that if we invest properly in them will help to relieve or at least constrain the pressure on our acute sector. Now, as I say, at times that will be difficult for staff. I fully understand that. At times it will be difficult for politicians. But, you know, the health service in Scotland is not unique in this sense, that it faces challenges that are inescapable challenges. It's how we respond to those challenges that will determine how well our health service copes. And what I would say, just in my final point here, is our health service, yes, it faces challenges, but as the Auditor General said in the recent report, compared to other health services across the UK, for example, NHS Scotland is performing well. Waiting times are lower than they were when this government took office. Patient safety is better. Hospital infections have reduced dramatically. We see hospital mortality reducing. So, you know, our health service is doing great things. What we've got to do is make sure we support it through the transition that lies ahead of it over the next few years to make sure it can continue to do great things.
Yeah, a very short
Yes.
supplement, if I may
So,
ask First Minister a very short answer,
Do
please.
you accept that the evidence that we are hearing is accurate?
You hear a lot of evidence, and some of it I will perhaps take a different view of. So if you want me to say, what I'm not saying is anybody's coming to your committee and saying things that are not true, but you get a lot of evidence. Some of it I will agree with, some of it I will have a different interpretation of. So if you want to ask me about a particular bit of evidence, if I think it's accurate or I agree with it or not, I'll do that. But, you know, that's a very, very general question.